Hi, my name is Chrisia Diaz, and this is my recommendation for attachment-focused family play therapy. Attachment-focused family play therapy views presenting problems as manifestations of disrupted relationships and attachment issues within the family system. These problems often stem from miscommunications, unmet emotional needs, and ineffective parenting practices. It recognizes that children's symptoms such as anxiety, aggression, or withdrawal are often expressions of their struggle to connect with their caregivers to manage their emotions. The major theorist for this model is Kathy Spooner. She was certified in basic STEM therapy. She's also a certified trauma specialist, and she trained in dialectal behavior therapy. There were also two other key figures, John Bowlby and Mary Ainsworth, and they also did attachment therapy, as well as Mary Main and Judith Solomon, who also contributed. The epistemology and theoretical assumptions are as this. The theory is grounded by neuroscience. Prolonged activation of the body stress response creates maladaptive behaviors that will become hardwired, creating trauma symptoms that are persistent and maladaptive. Also, attachment theory, which explores how the quality of the relationship influences a child's social and emotional development, also emotional regulation, and the ability to form healthy relationships. The family system theory, which focuses on understanding the complex interactions between family members and their communication patterns to better understand the behaviors of those family members. But there are some guiding principles for this theory, and that is the families are generationally complex. Children innately desire to have a positive relationship with their parents or caregivers, and that way they can feel connected, as well as a sense of belonging. Children thrive when they have a positive and loving relationship with them, as well as when there is some structure or some limit settings as well. An effective parent under this model is a self-aware parent, so that way they can provide the foundation for developing a healthy sense of self, and as well as for learning to regulate emotions. Our biology directs our behavior and is heavily affected by the environment. The major concept of this theory is that it explores how the quality of the relationship between the parent and caretaker and the child influences several parts of the child's social emotional development, as well as emotional regulation and the neurobiology. To target the problem, there are two concepts that as therapists we would use. One is using the acronym SPACE, which stands for structure and flexibility, play, aware, and present for attunement, and curiosity for understanding and exploration, as well as empathy and acceptance. Another part of the theory is using the 3 R's, which is reflexive communication, regulate emotions, and repair relationship ruptures. For attachment-focused family play therapy, there are some materials that are needed. So here's a list of my proposed materials that I would need. A sand tray. Sand therapy can be utilized to help children play out their emotions and memories if they have trouble verbally expressing it. Balloons can often foster teamwork within the family. Art materials. This could be markers, crayons, glue, scissors, construction paper. Art therapy is essential to help children express themselves when they can't verbally do it. Board games, besides being fun, they provide a structure and teamwork environment. Puppets as well would be one of the items that would be needed, as puppets can promote emotional expression. For the therapeutic space, for the room, I would need a table and chairs to accommodate small children. Also, a table and chair to accommodate the therapist and other adults. Bookshelves as well to put away some of our books and materials and other resources. A puppet stand to hold our puppets. Dry erase boards that can be utilized by the children to draw as well, and a rug or a mat, so that way it can also be more accessible for children to sit in a comfortable space if they don't want to sit on a chair. The focus of the intervention is the here and now of the family's relationship, by practicing co-regulation, attachment, and reciprocity. The model can also focus on healing from the past, such as any trauma that the family may have experienced, which is influencing the present dynamics of the family system. Attachment patterns as well, relationships, any change in the play and the guidance of the therapist, as well as any emotional regulation. There are 4 steps to the treatment process. The first one is observational assessment. We want to make sure that we're providing safety and structuring for expectations. The second one is safety and engagement. We need to make sure that we're creating a sense of safety in the sessions through therapeutic presence and confidence in the family members and parents. The third is realignment. During realignment, we do this dance of acceptance of change while also maintaining therapeutic support. And the fourth one is attunement and termination, which basically means that we're turning over the reins to the parents using attachment-based parenting skills. The clinical interventions are done in 4 phases. Observational assessment is the first one. This is very low distress, very open-ended questions. We're just letting the family interact on their own. The second phase is the safety and engagement phase. This is where the fun activities come in. We build rapport. The third phase is realignment. We're targeting specific issues by inciting any challenges. And the purpose is to change the patterns in the interaction that we're having. The last one is attunement and termination. This is targeting to reinforce secure attachment interactions, as well as utilizing activities that reinforce the new skills. It's important for the therapist to explore with parents during the sessions the extent and the nature of cultural influences within the family relationships and how trauma is perceived within a cultural lens. Of course, we always want to make sure that we're being inclusive in terms of race, gender, religion, neurodiversity, any type of ability or disability, age, language, class, etc. Cultural considerations should be discussed before therapy to ensure that the therapist implements in the treatment model this with the sensitivity and nuances of the family's culture to help them heal. And the therapist will also need to integrate any kind of multicultural art supplies, games, books, and toys when working with families. As with any type of therapy that we are doing with our clients, we need to make sure that we are going over the legal and ethical considerations with them. Number 1 would be our confidentiality agreements. We need to ensure that our patients understand informed consent, as well as what your states consider or the definition of a minor is. We want to make sure that we're encouraging all of our clients to ask any questions in terms of what the process is. We need to also be letting the families know the legalities still apply in a telehealth setting, as well as the parameters of us being mandated reporters. Attachment-focused family play therapy can be accessible through telehealth. We need to make sure that we're informing our families that confidentiality still pertains through telehealth. For telehealth, we can create a virtual play therapy room for our clients, which would include a variety of play therapy activities that we can do. Here's my recommendation summary for attachment-focused family play therapy program. The model is based on 3 components: neuroscience, attachment theory, and family systems theory. Children thrive when they have a positive, loving relationship with parents that is balanced with structure and limit setting. A variety of toys and materials is beneficial for this therapy. The focus is here and now for the family relationship by practicing co-regulation, attachment, and reciprocity. This theory or program will foster growth in attachment patterns, emotional regulations, and relationships. Thank you for taking the time. I did a lot of research on the program effectiveness, and I'd be more than happy to share any of my resources. Here are the references and resources that I used for this presentation, and thank you for taking the time to review it.